With so many people suffering from the effects of clinical depression every day, it is important for us to examine which methods of treatment yield the best results. Through the course of this debate, I'm going to attempt to convince you that therapy is superior to medication for treating clinical depression. As a primer on my main points of my argument, I am first going to define my value objects. I am then going to describe my value criteria and hierarchy by which I will judge them. And finally, I'm going to present evidence in favor of my proposition. So having introduced my proposition, I'm going to move on to my three main points. First of all, I'm going to define my value objects. So the two treatments that I am going to be comparing today for treating clinical depression, the first of which will be therapy. And that's going to be defined as any kind of talk therapy with a professional psychologist or psychiatrist, usually in the form of cognitive behavioral therapy. And the second treatment that I'm going to be comparing it to, my other value object, is going to be medication. And that's going to be broadly defined as common antidepressants, SSRIs, things like that. So having defined my value objects, I'm going to move on to describing my value criteria and hierarchy. I'm basically going to be judging the value of each treatment in three key areas. The first of which will be presence or lack of presence of negative side effects. The second area will be longevity of positive effects of the treatment. And finally, the relative cost effectiveness of each treatment. And why you should really care about each of these is, first of all, for lack of negative side effects or the presence of them, if you're getting some kind of treatment for mental health and you're trying to make your everyday life easier, having physical or mood changes is going to be sort of counterintuitive to that. So you're hoping ideally you'll have as few of those in your treatment as possible. In terms of longevity of effect, especially if you're going to be putting a lot of money into this as your primary form of treatment, you're going to want it to have some, at least semi-permanence that you can rely on for a long period of time. And finally, cost effectiveness kind of explains itself. If you're in an economic situation where you can't afford both of these options, which would probably be ideal, medication and therapy, you want to look at which one is going to be, if either one is superior from a cost effectiveness standpoint. So now that I have described my criteria and my hierarchy, I'm going to move on to the evidence for my proposition. So my third main point is that due to a lack of negative side effects, more longevity of positive effects, and relative cost effectiveness equality to the other option, therapy is the superior treatment for treating depression over medication. Now the first point is going to be lack of side effects and presence of negative side effects in antidepressants. Now, it should be said, the objection could be made that therapy has a barrier to entry. It can be intimidating, and that's true. But once you get over that hurdle, it's not like an antidepressant or a medication. It's not medicinal, and you're not putting something in your body, so it's not heavily affecting your biochemistry. It's going to result in these very noticeable physical and mood symptoms. In Arthur Allen's March 2011 article, Coping with Side Effects of Depression Treatment, it's mentioned that antidepressants can carry with them a number of unpleasant side effects, such as nausea, fatigue, constipation, and lower sex drive. It's important to note that most of these are only supposed to last about 2 weeks, or you should maybe switch medication. But some of these side effects can persist for longer, such as changes in libido or lower sex drive. The second point that I want to make is that therapy has more longevity of its positive effects than medication. In Deribus, Siegel, and Holen's September 2008 article, Cognitive Therapy versus Medications for Depression, Treatment Outcomes and Neural Mechanisms, it stated that cognitive therapy is just as effective as antidepressants for treating depression, and it reduces the chance of relapse even if the treatment's discontinued. So basically, you might only have a finite amount of therapy that you go to, but the positive effects of that treatment kind of stick. And that's not so much the case for antidepressants all the time. In the case of a Harvard Health Publishing article from March 2014, What are the real risks of antidepressants? It's mentioned that any antidepressant can lose its effect over time due to the brain's growing tolerance to the drug. So you may end up over time, you have to increase your dosage, or you maybe need to switch to a medication, which is a bit of a headache. And you don't so much have to worry about that with therapy. And the third point that I want to make is the relative cost-effectiveness equality between both options. Now, there might be sort of a misconception that with therapy, it's a bit of a, some people might think it's kind of a racket, especially depending on the severity of your symptoms and the specialist maybe you're seeing, that you have to take time off from work, maybe go to some professional specialist in treating depression. It could be more expensive, but actually, in Kara Gavin's October 2019 article, in the long run, drugs and talk therapy hold same value for depression patients. That's kind of a self-explanatory title. It's shown that once they adjusted for long-term effectiveness, neither option seemed to be clearly superior in terms of cost effectiveness. So financially, they're about equal. So you would probably want to refer to the prior to criteria, areas of criteria for judging which is the superior option. So now that I have presented evidence for my proposition, I'm going to close with some concluding remarks. Through the course of this debate, I attempted to persuade you that therapy was superior to medication for treating clinical depression. I defined my value objects, I described my value criteria and hierarchy, and I provided evidence for my proposition. I'll leave you with this. With mental health affecting so many facets of the entirety of our lives, it's important for us to examine which is the most effective treatment for us to take. Thank you.